You've made it on time. We want to reward you and get this started on time so we don't have you here all evening. A couple things before we start the presentation. You probably noticed refreshments as you walked in. If you didn't grab some, you can grab some now, or feel free to grab some at the end of the presentation. The other thing that I wanted to mention was, I know some of you are familiar with our firm and the advisors, but for those of you who are not, I just wanted to provide a brief introduction about us. My name is Greg Simmons. I'm one of the financial advisors at Net Worth Advisory Group. The firm has two managing partners. One of them is David Swap, back in the corner, and his other partner is Ray Levitri, and he couldn't make it tonight. Also joining us is Curtis Smith and Mike Berry, who are advisors at the firm, as well as some of our staff. Our firm is located actually on the first floor of this building. If you were to take the elevators down and take a left, you would see our offices at the end of the hall. A couple things about our firm that we believe separates us from some of our competitors is that we believe in a CFP certification. CFP stands for Certified Financial Planner. Now that seems like a common thing that you would expect your advisor or financial planner to be certified, but unfortunately, the vast majority of advisors and financial planners are not certified financial planners. The reason is it's a tough designation to achieve, and it takes quite a bit of time. Every advisor in our firm is either a CFP or is currently enrolled to become a CFP. Another thing that separates us is we're fee only. Some of you are probably familiar with that term, but what that means is when we provide recommendations and advice, that is based on the best interest of our clients, not our pocketbooks. Most of our competitors are commission-based, and so they're compensated from the products and things that they recommend. We're compensated directly from our clients. The advantage to our client is that we always have the motivation to help them become successful in their financial goals and aspirations. The last thing that I wanted to mention is we're big believers in comprehensive financial planning. We believe that in order to help our clients obtain their financial goals, we have to develop a financial plan for them. In fact, that's the very first step that we do with every one of our clients is we develop a written financial plan for them. And in that plan, we go over retirement planning, estate planning, education planning, investment analysis and recommendations, pension analysis, Social Security analysis, obviously insurance planning, which is why Medicare is a part of that. And so because we're fee only, we don't sell insurance and things of those nature. And what we do is we align ourselves with professionals who we believe hold the same standards and goals that we want to achieve for our clients. And so that's why we've partnered up with Senior Med Benefits, and Julian will actually be giving us the presentation. One of the reasons we like Senior Med Benefits is a lot of the times when you meet with a Medicare professional, not only are they going to talk to you about Medicare, but they're also going to try to sell you on some additional products. When you meet with Senior Med Benefits, their goal is to help you understand your questions and answer all the things that you have regarding Medicare. And so that's one of the reasons we like working with them. The other reason is we've referred clients to them, and all the response and feedback that we've got has been positive. And so with that, I'll turn the time over to Julian.
My name is Julian Ortega, and I'm just going to introduce a couple people in the back. My sister, actually my sister boss, it's a rough life. She is actually the owner of Senior Med Benefits, and then Audrey Giggy is one of our main agents in different counties that we have here in Utah. So we are a brokerage. One of the main things that's important to talk about that is there's different types of agents. There are those who are captive and those who are independent. Captive agents are those who only work for one specific Medicare company. And I believe there's 7 different Medicare companies here in the state of Utah. So if you meet with someone like it's an independent or a captive agent, guess what they're going to talk to you about? Just that one company, just those one products that company offers. And then there are independents, brokers like us. We are actually licensed with every single Medicare company and product and option you even have as a Utah resident as you approach your Medicare. So our main goal, as he gratefully stated, is our main job is to educate you on what's coming up, make sure you know what decisions you have to make and when you need to make them, so that way you do not receive any type of penalties. And I'm going to go through all that for you. The only thing I also say is, as you approach your Medicare, we always just beg of you, use an agent. Even if it's not us, that is completely fine. The main reason why is because if you do this all on your own, you need to educate yourself on your own, you need to apply on your own, you need to hope the application is done correctly, and then if you ever have any issues throughout the year on that company, it's between you and customer service, and we don't know where that call center is going to be. And then, not only that, every single year, something called open enrollment, and we'll definitely get on that in a second. Open enrollment is when everyone who's already on Medicare has the right to assess what they've been on, determine if they need to make any changes, and if you do this on your own, then it's up to you to make sure you know exactly what's changing with Medicare, what's staying the same. And the good news is, if you do it all on your own, it's completely free, but hopefully it's all done correctly and hopefully you don't have any issues. If you use an agent, it's your agent's job to make sure you're educated on what's coming up, that you are applied correctly. If you ever have any issues with your coverage, it's not between you and customer service. You call your agent. Your agent's the one that makes sure, the liaison to make sure you are taken care of with the company and the product. And then it's your agent's job to reach out to you every single year to make sure you know what's staying the same, what's changing, and assist you in making any adjustments you need during open enrollment. So, and guess how much we cost? We are free. So you can do this on your own and it's free, or you can use an agent, it's completely free. So we just always beg you, even if it's not us, no worries at all. Use someone you know and you trust, and we just encourage you to have a liaison on your side, especially in the, I don't know what the word tumultuous, Tracy's agreed. Ever-changing healthcare that's happening right now. Yeah.
He needs a cookie.
Yeah. With that being said, what I first start doing is I always just go over the basics of Medicare. I'll educate you on the foundations of Medicare, and then I'm going to let you know what laws have come into play, what changes have been made, and what you need to be aware of, okay? So, I don't know. Usually we meet with usually you really want to focus on what's coming up with your Medicare 6 months before you turn 65, okay? Medicare is for two different types of people. It's for those who turn 65 or for those who have been on disability for more than 2 years, all right? So, there's what's called an initial enrollment period. So, an initial enrollment period, you mean you're initially going into Medicare, whether that be 65 years old or whether it be after 2 years of disability. You get 3 months before your 65th birthday or 65th month. You get the month of, and you get 3 months after to make decisions on what you want to cover you, all right? So let's go over just the foundations of Medicare. First and foremost, there are 4 parts to Medicare. All right, there's A, B, C, and D. And I'll move out of the way for some, I'll apologize. A is your hospital coverage. B is your medical coverage. C is what's called a Medicare Advantage plan, and I'll address this in just a little bit. And D is your prescription drug coverage, okay? A and B, this is called Original Medicare. It's called Original Medicare because it has not changed since it was originally created in the 60s. But everything else has. New laws, new requirements, and unfortunately new penalties if you do not line up with those new laws and requirements that Original Medicare does not satisfy, okay? Part A is your hospital coverage only. I try to make this simple by just saying, think of Part A as hospital admittance and hospice admittance only. So basically, if you enter into a hospital and they assign you a room, that's all A addresses. Everything else, so like doctor visits, specialist visits, that's all under Part B. So keeping A simple is just getting a bed in the hospital, all right? Part A will cost you nothing as long as you did at least 10 years, aka 40 quarter hours of workforce where you contributed to Medicare, okay? Where a majority of people who have worked over 10 years, they'll get Part A for free, all right? Part A is free to have, but it's not free to utilize. So if you ever were to actually be admitted into the hospital, it is $1,316 per visit. Now, I won't make it difficult. There's asterisks, and if you come back within a certain amount of time for the same issue, then you don't have to pay again. But keeping it simple, you can just think of, if I get a bed at the hospital, it's $1,316, okay? That's all Part A is. Part B, this is what everyone must pay and if you want to be on Medicare, you must pay to be on Medicare. And for the majority of Americans, Part A costs $134 per month. Okay. Here's what's important to know. This is what the law states. The law states that everyone who turns 65 must go on Medicare or else they'll start receiving penalties. Unless you are actively employed or you're the spouse of someone who's actively employed and you directly have insurance through that active employment. So the only way that you can defer your Medicare Part B and not have any penalties is if you're still working or your spouse is still working and you yourself have insurance directly through whichever direct employment that is. Does that make sense? So for that reason, I say that specifically because we come across a lot of, especially here in Utah, a lot of federal. I don't know if there's anyone here that is on federal or is going to be having federal retirement benefits. Even though it's federal, if it's retirement, if you're not actively employed, the government does not see federal coverage as Medicare equivalent. Okay? So you would, people don't like me anymore. I just got really bad looks. Tracy, your turn. Yes.
134 per person.
134 per person. He asked if, Maddie. He asked if the $134 is per individual. It is. Medicare is always individualized. You cannot group it with your spouse. Okay? So, federal retirees. VA, if you're a veteran, VA is substantial or satisfies prescription requirements. So we'll kind of go over all that. And we also have some options for you if you are a federal retiree. There are some options that the government does give you, since I assume they realize that a majority of federal retirees make the same groans and looks that you just made. So they give you some options to suspend federal benefits to go on Medicare so you're not receiving Medicare penalties. And we can go over that in just a little while. All right? Now, if you are receiving Social Security already as you approach 65, the government is going to automatically sign you up for A and B. You don't have to do anything. If you do not want A and B and you're receiving Social Security, this is a mental note for you that you have to specifically, when you get your Medicare card, you have to, there's a little area, and it's probably like a magnifying glass font. You have to check this box and send it back in if you don't want your Part B. But if you are receiving Social Security, you are going to automatically be signed up for A and B. Also, if you're receiving Social Security, your Medicare premium of $134 is going to come out automatically on your Social Security check. Now, what's important to know? If your birthday is on day 2 through day 31 of a month, your Medicare will begin day 1 of that month. So if your birthday is March 2nd through March 31st, your Medicare begins March 1st. If your birthday is on the 1st of a month, then your Medicare begins the 1st of the previous month. So if your birthday is March 1st, your Medicare began February 1st. Okay? Now, 134, I circle it, because there's a couple things to go with that. If you are a low-wage earning household, you're on Medicaid assistance, then the state of Utah will pay that premium for you. However, on the exact opposite, if you're a high-wage earning household, which I know everyone whose clients with net worth is all, because of their expertise, they make you a high-wage earning household. That's a promise that I will not put my name on. So, if you're a high-wage earning household, and high wage is always based off of taxes from 2 years previous. The government always looks at your taxes from 2 years ago to determine if you're a high-wage earning household. But if you are, you could have an upcharge. I always encourage you to look at the factual numbers. Tracy, you can help me out, but I believe if you're single, it's around 80,000 gross. 85, sorry. 85,000 gross for an individual. For a couple, 150.
170.
Okay. Thank you, Tracy. Cookie. All right, so if you're a high-wage earning household, you will get a notification from Social Security that will let you know that you have an upcharge on your 134 premium. Okay. I also circle it because I'm going to go over a couple options for you. One option gets rid of these costs. Another option gets rid of these costs. But the one cost that will never go away is the Part B premium. Everyone must pay to be on that, all right? Part B also have a deductible of $183 per year. So that means if you're on Part B, you have to pay $183 out of your own pocket first every single year towards your doctor visits, specialist visits, anything medical. And then your Part B benefits kick in at an 80-20 split. This is where the government covers 80% of everything you do, and you cover 20% of everything you do. Sorry. Here are the pros of Original Medicare. No networks. You can go to any doctor, any hospital, any facility in the entire country. As long as they accept Medicare and as long as it's medically necessary, it is yours, and no one will tell you no. And the government will cover 80% of the entire cost. The negative side of Original Medicare is this 20%. You are on the hook for 20% of everything you do with no, we call it the MOOP. There is no max out-of-pocket protection on that 20%. I'm not going to give you a fear scenario, but as you all know, 20% of even a basic accident and hospitalization, 20% can be substantial. So that's why no one ever stays on just Original Medicare, because that 20% can easily wipe people out financially if the wrong situation occurs, all right? However, in 2006, the Bush administration passed a law saying that everyone who's on Medicare, doesn't matter what type of Medicare you're on, you must also have some type of qualifying prescription drug plan. Now remember, retirement benefits are not qualifying, only active employment insurance is qualifying. So you have to have a prescription drug plan on the side. Prescription drug plans in the state of Utah are anywhere from $17 to about $80 max per month. Well, actually, I think there's one that's over $100, but about $17 to $80 per month for a prescription drug plan. And then you just have co-pays and co-insurances for all your prescriptions. Okay? I'll revisit this a lot in just a little bit. So this is your first option. Your first option is if you know you need to go on Medicare or you want to go on Medicare, your first option is to get Original Medicare with a prescription drug plan on the side. Now, if you're actively employed and you have insurance, like I said, you can choose to defer. I will tell you, choosing to defer active employment insurance isn't always the best option. There's no blame, but I know Tracy, who's done this even longer than I have. For the longest time, years ago, she would, if she called someone who was actively employed, they would say, I'm deferring Medicare, my benefits are great, my premium is low. There have been some significant changes to employer benefits due to changes to healthcare. And so we have seen a significant rise in people saying, I'm crawling to Medicare. Even though I'm still employed and I have insurance from my employer, Medicare has better benefits at a lower cost. So that's something that you definitely want to look into as well, all right? So that's your first option, Original Medicare with the prescription drug plan. I don't really know anyone that ever does just that. Really what we're going to go over in great detail is your second and third option. Your second option is what's called a Medigap. Some call it a Medicare supplement. I'm sure during times of the year you probably you hate the television because all you see is Medicare supplement commercials. Here's what a Medigap does, all right? In this, there are actually 10 different types of Medigaps. There are Plan F, Plan C, Plan G, Plan N, Plan K. There's all these different types of Medigaps. The great thing is Medigaps are government mandated. So let's say you got a Plan N on one company. It is T-crossed, I-dotted, identical to a Plan N on any other company. The benefits are identical, but each company charges you different premiums for that benefit. So what we would do is we'd say, what type of Medigap do you like? And then we would try to find you the company that gives you the Medigap at a reasonable price, but not just necessarily the cheapest, because every single company increases. The larger companies increase about 2 to 7%, would you say, T? And some of the other companies increase in the double digits every year. So just because it's the lowest cost introductory doesn't make it the lowest cost in year 2 on, okay? So what a Medigap does, even though they're identical, there's 10 different Medigaps, and if you were to know them all well like we do, you'd be able to see like 3 different categories. There's low premium, low benefits, mid, high premium, high benefits. I'm going to discuss with you what's called a Plan F. It is the high. We're not discussing a high with you because we think that's the one you should go on. It's because it's the only one we can describe that you're going to have a really clear idea of what a Medigap does. And then you can say, you know what, I like that premise, but maybe I don't need that much coverage. And you know you have 9 different plans you can scale back on, okay? And it'll scale back your premium.
High benefits and high premium?
High premium, high benefits is the Plan F. We call it I think Tracy calls it the Cadillac of supplements of Medigaps. It's truly the best insurance an American could have. So Tracy's like, yes. All right, so what a Medigap does. Remember I circled this because everyone pays this regardless, unless you have Medicaid. Everyone's going to pay their Part B premium. For an additional $144 per month, what a Plan F does is it fills in the gaps of Medicare. All right? So you see there's a gap here. That $144 pays that gap, so you never have to pay to get in the hospital. There's a little gap here. It pays that for you, so therefore your 80-20 rule begins immediately. Government still covers 80%. This Medigap covers your entire 20%. It basically says, I pay a high premium every month, and I never have a single medical out-of-pocket bill, ever. Okay? It's 100% coverage. It's still filling in the gaps of original Medicare, so it's still original Medicare. And as you all know, that means you can go to anyone in any facility, any doctor, any hospital in the entire country. And as long as it's medically necessary and they accept Medicare, you have 100% medical coverage. Okay? It's also still original Medicare, so you still have to get a prescription drug on the side. Prescription drug plan on the side.
So is that per person?
That is per person, yes, sir. Now, again, I'm going to describe one other one. I think it's important to note. Plan F is not the only type of Medigap. I'm going to go over one more that Plan F is, I put 2 different types of people on Plan Fs. Those that have the money and just want to make sure that they are covered today, tomorrow, they don't have to worry about what's going to happen in life. Or those who have significant illnesses. And the main reason why is because when you are approaching Medicare, Part B, that's what's called your initial enrollment period. Initial enrollment period is 3 months before, the month of, and 3 months after your 65th birthday month. In that time frame, you are guaranteed, and that time frame only, you are guaranteed any Medigap on any company, no pre-existing condition questions asked at the introductory price. That time only. If you, for any reason, decide not to go on a Medigap the first time you go on Medicare, and you decide later on in life during open enrollment, and I'll talk about those dates in just a little bit, if you decide to evaluate your health year after year and you decide later on that you want to go on a Medigap, then you're going to get asked questions. You're going to get asked 3 questions that will automatically deny you. One is, have you been hospitalized in the last 90 days? Do you have end-stage renal disease, which is a kidney failure? Or surgery?
Doctors told you
Doctor, within the last 2 years, a doctor has requested or performed surgery on you.
No.
Oh, that has not been completed. That has not been completed. So, anytime after that, if you decide to go on a Medigap, if you answer yes to any of those 3, you're automatically denied a Medigap. If you answer no to all 3 of those, then you'll get a Medigap, but now you have 2 pages of pre-existing conditions you have to answer. And if you say yes to even just one of them, you're still approved, but your premium just skyrocketed. Okay? So, I'm going to discuss, this is a Medigap that I put people on that have significant illnesses and frequent medical facilities often. Yes, ma'am?
So you're paying 144 plus 134.
Correct. If you go on a Medigap,
Something.
yes, she's asking the premium. So if you go on a Medigap, yes, you will pay. Everyone pays this.
278
Correct. Plus a prescription drug plan.
prescription.
I'm going to describe a Plan N because it's helpful for individuals who like a Medigap but don't need that much. Okay? What a Plan N does is for about $95 a month. So you're saving, $50 a month. That's $600 a year in premium. What a Plan N does, it does identical to everything a Plan F does except for 3 things. You have to pay the $183 Part B deductible, which is again just one time per year. And if you go to a primary care physician, not a specialist, if you go to a primary care, you pay $20. Everything else they do to you in that primary care is all covered. If it's a specialist, it's all covered. And if you go to the ER, it's $50. Everything they do to you in the ER and afterwards, all covered. Urgent care, all covered. So a plan N, you're saving $600 in premium. You have to pay that one time per year Part B deductible of $183, and then you have these two co-pays, but only for these two specific visits. Everything else is still covered 100%. Does that make sense? So that is a great option for those who like the premise of being covered 100% and don't utilize the facilities, the medical facilities, often enough to say $600 is worth it. Okay. I'm going to write two numbers out here. Well, one number. I'm going to say around $2,000. The reason I write this out here is if you decide you want to go on a Medigap, this is not including this premium. I never include this premium in any option because you're going to pay that regardless. All right. But if you go on a Medigap, you're looking at about $2,000 a year between a Medigap and the average prescription drug plan. You're looking at about $2,000 a year in premium, whether you go to the doctor one time or 100 times.
For which plan?
For the average. I'm saying you're looking at about $2,000 if you go on a Medigap. And that's not including the 134. Okay? I say that because some people like to see $2,000 and I rarely ever utilize a medical facility that's hard for them to stomach. Or some people think $2,000 and I never have a penny come out of my pocket for anything medical I need. No brainer. It's up to us to figure out kind of where you're at. That is the second option. Did that make sense? Great. So second option is a Medigap with a prescription drug plan. Third option is a Medicare Advantage. Now, the good news is it sounds like this made sense. Great, forget it all. Okay? So what a Medicare Advantage plan does is it takes the complexity of Medicare and it throws it out the window and says this is too difficult, and it turns Medicare into traditional insurance that I'm sure all of us are pretty familiar with. Okay? So what happens is if you choose a Medicare Advantage plan, you have to choose a company. That company now takes management of your Medicare away from the government. The government no longer has anything to do with your Medicare. They take management of it. They take your A, they take your B, and they take your D, and they put it all under one roof, and that roof is Part C. They take it all away from the government, so because now the government has nothing to do with it, they don't have to follow the complexities of what the government says. So they say there is no more deductible for Part A. There is no more deductible for Part B. There is no more 80-20 rule. All that's government mandated fluff, in their opinion, not mine. Make sure that's on camera. They basically just throw it all out, and they say they turn traditional into traditional insurance. They now cover everything, so they even give you your prescription drug plan, the majority of them are for free. Okay? And what it does is there's 7 different Medicare Advantage plans here in Utah. 5 of them are free. Okay? One of them's 24, and another one's about 29. So you're looking at a majority range of $0 to $29. Okay? Per Medicare Advantage plan. So you're going to pay the Part B premium. Everyone does.
Per month.
Per person per month. Yes, sir. Yeah, that's what that premium is. So a majority of options give you a Medicare Advantage plan for free. So they pay your deductibles and your prescription drug premium all for free. And then the other 2 main ones in Utah are $24 to $29 per month. What they do is they say if you never utilize the medical industry, you pay nothing unless you have a premium. But if you do utilize the medical industry, you have flat co-pays and co-insurances for everything you do. Everything you do has a flat co-pay or a co-insurance. So let's say you go to the primary care physician. You're looking at anywhere from $0 to $10 in copay to go see a primary care. If you go to a specialist, you're looking at about $40 to $50 for a specialist. If you're hospitalized, it doesn't matter what the doctors, nurses, medicine, $50 box of Kleenex next to you that you never use costs. You have a flat copay of around $295 to $345 per day for days 1 through 5 or 6, depending on what company you're on. So what that means is, if you're hospitalized, it doesn't matter what all the costs are. Anyone who looked at you, thought of you, touched you, or talked to you, doesn't matter what their bill is. You have a flat copay of $295 to $345 per day. If you're in the hospital for more than 5 days in a single stay, you're done, covered 100% the remainder of that stay, even 6 days, depending on what company. Okay?
So the 295 and 345 is only for days 1 through 5?
Correct. The $295 to $345 is the hospital all-inclusive copay for days 1 through 5 or days 1 through 6. Whatever company you're on, it determines whether the length of stay is. If you're in the hospital in a single stay more than that day max, you're covered 100% the remainder of the hospital stay. Okay? Now, when people choose a Medicare Advantage plan, it is never the benefits or the copays, in my opinion, in my experience, that makes someone determine what company they want to go with. Because nearly every Medicare Advantage plan has near identical benefits. Every Medicare Advantage plan has near identical copays. We're looking at $5 to $10 difference in copays for doctor visits, $40 to $50 copay difference for hospital visits, which is pretty much nothing in the grand scheme of everything. What always determines is the network of a company. When you choose a Medicare Advantage plan, you're no longer on original Medicare. Your Medicare is now owned by a company, and now you have a network of doctors and facilities that you must stay within in order to get the benefits you're promised at your copays. Okay? What's also nice is every single company has max out-of-pocket protection. We're looking at $4,700 to $6,700. So what that means is, if you're paying copays after copays after copays, if you reach your max out-of-pocket for that company, you're done. You're covered 100% the remainder of that calendar year. And then it all starts over in January 1st. Okay? Now, I'm going to go over networks in just a little bit. But with Medicare Advantage plans, all of our members usually ask, they say as they get older, they lose 3 things. They lose their eyes, they lose their ears, and they lose their teeth. Medicare does not cover 3 things: eyes, ears, and teeth. So to entice you a little bit, and I'm going to be very, very honest with you, nothing is substantial or very comprehensive. But to entice a lot of people, Medicare Advantage plans will give you some type of dental, hearing, and vision benefits, and they will all give you fitness benefits. Has anyone ever heard of like Silver Sneakers or Silver and Fit? Great. Silver Sneakers and Silver and Fit, those are programs that allow you to go to majority of the box office gyms, the Bosses, 24-Hour, Planet Fitness, all the Curves for Women, all the rec centers, all the YMCAs, all for free. So by being on that company's Medicare Advantage plan, you can go to those facilities for free. And you don't have to choose one. You can go to Vasa in the morning, you can go to Curves in the afternoon, you can use the rec center's pool in the evening. Okay? Now they all give you some, not all of them, but the majority of them give you some dental, vision, and hearing. Now here's the reason I want to touch on that, because it's nice, but none of it is comprehensive. So if you truly need comprehensive dental, vision, or hearing, then you have to do a separate dental, vision, hearing plan on the side. For those of y'all who are working still and you have insurance and you're contemplating going to Medicare, a majority, I can't say 100% if all of them do, but a majority of companies will let you separate your medical from your dental, vision, hearing. So a lot of companies will allow you to terminate your medical, go on Medicare, but keep your dental, vision, hearing with your company. I, for the majority, always encourage to do that if you're looking at terminating your medical with your company. Because every single time you go on any type of dental, vision, hearing company, you have to start over with your probation periods. You have to be on the plan for a certain amount of time before you get certain benefits, and more than likely you've already met those with your company. Okay? Did that make sense? Yes? Any questions I can answer for you right now? Yes.
So how does the Medicare Advantage make money? Do they take the Part A and Part B and?
Great question. So I know where you're going. So what he asked is, how do Medicare Advantage plans make money if they're charging only $0 to $29 for the majority of them? This is how it works, and I'm going to really need my sister in a second. No, when you choose a company, again, that company takes management away from the government. If you do not go on a Medicare Advantage plan, guess what type of liability you are to the government? You're an 80% liability to the government. The government is sitting there waiting for 80% of your bills. So if you go on a Medicare Advantage plan, they're no longer liable for you. So the government's saying, great, take them. Take that $1 million liability. We'll pay you a certain amount of money. I don't know what that amount is. I don't think really anyone, I think your husband knows, but my brother-in-law knows what that amount is.
They're county specific, so if you're in Orange County, obviously they're paying more per month to the insurance company than maybe here in Salt Lake. So it's per county, you can probably count on $500 to $1,000 a month that the government is shifting the risk to the insurance company to basically fully insure.
Right.
And not be on the hook for that.
Yeah, they're no longer responsible for 80% of every bill that you have. So they're saving millions of dollars by paying a company to take on that risk. Okay? So that's how they make their money.
And so they make it because they take on the risk.
They take on the risk, and that's why a lot of them still offer a zero premium, because they're like, we like the risk because we like that monthly stipend coming in for every single enrollment we have. And then they're just crossing their fingers that you're a pretty healthy individual. But if you're not a healthy individual, or you are utilizing, at least you have some type of contribution to your health to help out with the cost, and you have max out-of-pocket protection. So worst case scenario, let's say you have a really, really bad year. They probably spending a lot of money on you, but at least they got $6,700 out of it back, in contribution. Does that make sense? Great. Yes.
What's the split between those who choose a Medicare Advantage plan versus?
Great. So he wants to know on average, about how many people choose a Medigap over a Medicare Advantage. I'm going to guesstimate from my experience, about 2 to 3 out of 10 go on a Medigap. About 6 or 7 out of 10 go on a Medicare Advantage. Would you agree, T?
Yeah, and there's a couple reasons that someone would choose one or the other. So Medicare supplement, we tend to find are folks that, one, can afford it and just say, you know what, I'd rather pay the premium and not ever worry about it. The other folks that take Medicare supplement probably have a chronic condition that if they are going to the doctor and hospital a lot, those copays are going to start to add up. And overall, the premium will cost less than Medicare Advantage.
Right.
Folks that take Medicare Advantage are like, especially folks coming off a group plan, will say, gosh, I have deductible or copays now. That doesn't freak me out at all. I'd rather hang on to that $2,000 a year. I won't make that up in copays because I'm fairly healthy. I go to the doctor once or twice a year. Or folks that just truly can't afford a Medicare supplement. They don't have the funds for that. We'll go Medicare Advantage.
Anyone need me to repeat what she said? I have a microphone, so.
Oh, I'm
joke.
sorry.
Yeah, why don't you?
Yeah. Oh, you took me up on it. She basically said everything Julian said was right. I'll address that with you personally. Yes.
Yeah, but now if you are on a Medicare Advantage and then you start getting chronic disease that costs a lot and so on, then to switch back to a Medigap would be expensive or
So good question. So I'm actually going to touch on that.
possible?
Do you mind if I kind of revisit that a second? Because I'm going to touch on enrollment periods that will answer that perfectly, and then I'll readdress the question. That's okay. Yes.
How does this work if you have post-medical with your company?
If you have post-medical.
Post-retirement, you should say.
So I don't know if you remember discussing this Medicare. The law says you must go on Medicare when you turn 65, or you'll get penalties unless you are actively employed and have insurance directly through that active employment. So if you're retired, you're not actively employed, so legally you must go on Medicare. Now I actually address something that I want to touch on. If for any reason you choose that you are not going to go on Medicare because you like the insurance you have, but that insurance is a retirement, federal or postal or something that is not seen as Medicare equivalent, you have the right to say, I have federal retirement, I don't want to go on Medicare. You have the right to decide that. But Once you turn 65 and you're legally required to, you're going to start getting penalties. Here's what the penalties are. 10% on the Part B premium per year, 1% on the average prescription drug plan premium per year. So for every year you're not on a Part B or Part D or both that you are legally required to, you're going to start accruing penalties. Now I kind of say it's in Medicare purgatory because those penalties will add up and add up and add up, but it doesn't bother you because you don't have to pay that right then. The only time you will ever have to pay Medicare penalties is if later on, thank you, yeah, please, is if later on you decide you want to go on Medicare. If later on you decide you want to go on Medicare, you're now, those penalties, whatever that penalty is added up to, thank you, Mike, whatever that penalty is added up to in Part B and Part D, you're going to pay that penalty, the sum. So let's say it's $50 in penalty you got on Part B and $15, $20 on Part D. Whatever that has added up to, you're going to pay that amount every month for the rest of your life on top of whatever that current premium is. So it is pretty extensive, yes.
But I think his question is, if you have a retirement plan, how does it work with Medicare? Is that your question?
Yes,
So-
if you have medical with
A
plan,
retirement.
retirement plan, how does that work with this?
Okay, thanks, Steve. So how does retirement work with your Medicare? So legally you have to go on Medicare. So let's say you choose to go on Medicare. You have two different choices. Majority, and I have not experienced any federal or any type of retirement plan that will not allow you to what's called a suspension. Not terminating, but what a lot of Blue Cross Federal or any type of federal and any type of like postal do is they'll allow you to suspend your retirement benefits and then go on Medicare because you're legally required to go on Medicare or else you'll get penalties. So they'll allow you to suspend those benefits.
Right, but what he's asking is, if
I'm not
you wanted to keep this retirement plan, Medicare would be primary, your retirement plan would pay secondary.
This is why she's the boss. Yes,
So it
you
would
have the
pay-
right.
Yeah,
You have the right to team them up. So you can team up your Medicare and your retirement, and Medicare will be your primary, and your retirement will be your secondary.
So then that way you wouldn't have to do the medical advantage program.
You would still have to get a prescription
Just,
drug plan.
If it's not united.
Correct.
well, he would
Well,
have to.
because it's retirement.
Retirement plan has a prescription, it's, as long as
Equivalent.
he gets Part B, it would be equivalent,
You're
he'd be
good.
fine.
Now, what I was so you have the right to do that. You have the right to keep your retirement plan and go on Medicare, and then they'll just coincide and be primary and secondary. Or you can do what we also do as a suspension. Majority of plans will allow you to suspend your retirement, suspend it, therefore you're not having to pay that premium, go on Medicare, and if at any time you decide you like your retirement benefits better than what Medicare is providing, during open enrollment for your retirement program, you can then call in and re-enroll in your retirement. So it's a good way for people to say, I don't want to pay this premium plus my retirement premium when I can just go on Medicare, suspend my retirement, suspend it, not terminate it, suspend it with no penalties, go on Medicare, and if at any time I decide I want to go back on my retirement, you can do so during open enrollment. Okay? And it saves quite a bit of premium. Yeah? Yes?
I want to revisit the dental, hearing, and vision piece.
Sure.
If you're using hearing aids, and then you're going to need to either pay it out of pocket, or you're going to have to add that on, or get Medigap.
Well, so again, Medicare does not cover eyes, ears, and teeth at all. But if you go on
But if you get Medigap, then that covers the.
a Medicare Advantage gives you some coverage. Medigap gives you nothing on dental vision.
My
here.
experience is it doesn't do anything for hearing aids.
There is a company, United Healthcare, that owns a company. United Healthcare owns a hearing aid manufacturing company called High Health Innovations. They will give you over the ear for $330 and in the ear for $380 per hearing aid. Now, that's why I said this is not comprehensive. That's a great cost. That's like 10% of what hearing aids cost. But they're also not these high Bluetooth, Siri, plug in my hearing aids. It's not, they work for a lot of people, but they are not high tech hearing aids. So if you need, there's also another company that gives you just a stipend, like anywhere from, I think it's $800 a year towards any hearing aid you want. They'll give you $800 towards
What
it.
is that?
That one's Aetna. So, and then other than that, pretty much nothing. And then dental, again, it's not comprehensive. A lot of them just give you 2 free dental cleanings within network. That's it. Another, or an exams and x-rays. Another one gives you $1,000 towards any medical dental, any covered dental, nothing aesthetic, not whitening or veneers and all stuff, but legitimate dental that you need, they'll give you $1,000 stipend. But so nothing's comprehensive, okay? It's just little perks towards those 3 categories if you choose to go on a Medicare Advantage plan, okay? Yes, ma'am.
So this is all individual, so are there a lot of people that do, one spouse does one and one does the other?
So she asked, since Medicare is individual, do a lot of spouses do it together or do a lot of them actually separate? It's all, since Medicare is individualized, as brokers and agents, our job is to say, what are your specific needs? Health needs, doctor needs, hospital needs. And a lot of times it is different than the spouse. Because it's all about your specific medical needs. Okay? I'm going to move on for time's sake, if that's okay. And then just remember those questions, and I'm going to address yours in a second. All right. I've said quite a bit about enrollment periods. All right. There are a few different enrollment periods I want to address with you. There's one that's called initial enrollment period. Again, when you decide you want to go on Medicare Part A and B, but especially Part B, that is your initial enrollment period. You have 3 months before, the month of, and 3 months after to choose what type of Medicare secondary you want. Okay? There's also another one called open enrollment. Medicare choices you make, when you make a Medicare choice, it's only good for that calendar. Well, it's only locked in for the majority of people within that calendar year. Because every single year from October 15th through December 7th, those are the 6-7 weeks where everyone who's already on Medicare has the right to evaluate what they're on, evaluate has their health changed, has their prescriptions changed, has the company gone bankrupt, has networks changed, and that's when we would address with you the changes and what's staying the same. And if you need to be on something else, it's those 6 or 7 weeks that you have the right to make an adjustment. Starting January 1st, that adjustment goes into effect. Okay? And then there's called what's Medicare Advantage disenrollment period. So let's say you go on a Medicare Advantage. From January 1st to February 15th. It's 15th. Check it. It's not on Valentine's Day. It's horrible. 15th. I'll give you to the 15th. You can put that on camera. So, Medicare Advantage disenrollment. It's that little bit of time, that 6 weeks, that you can, if for any reason, you can say, you know what, I made a mistake going on Medicare Advantage, and you can disenroll, go back to original Medicare, get a Medigap and a prescription drug plan. Okay? And then the last one's called special enrollment period. So all throughout the year, there are all different types of special enrollment reasons why someone can enroll in Medicare. You moved from out of your service area, let's say you went from one state to another, or even from the Wasatch Front to Washington County down in St. George. If you move out of your service area, you have 60 days to go choose a new plan. If you lost credible coverage through your employer, you have a certain amount of time to get enrolled in Medicare. If you're on Medicaid or low income subsidy, then you can choose different Medicare all throughout the year. So there's many different reasons why someone would be able to make an adjustment to their Medicare throughout the year. Not many are used, but there's a good amount of options, okay? So those are the main enrollment periods. Now, let's talk about prescriptions. Has anyone ever heard of coverage gap or the donut hole when it comes to prescriptions? Yes, okay. So I'm going to do the best I can to explain this because it can be a little difficult. If you decide to go on a Medicare prescription drug plan, whether it be a standalone prescription drug plan or whether it be included in your Medicare Advantage plan, this is going to apply to you. There are technically 4 stages to the prescription drug plan donut hole. 1, 2, 3, and 4. Okay, stage 1 is your deductible stage. Stage 2 is your initial coverage. Stage 3 is the coverage gap or the donut hole, which a lot of people have known it as. And stage 4 is catastrophic. Okay, stage 1, if your prescription drug plan, standalone or combined with your Medicare Advantage, if there is a deductible that you have to meet first, that's what stage 1 is. It means you hit your deductible and then you move on to stage 2, your initial coverage. Okay? I'm going to write some numbers up here and it'll make sense in a second. Okay. What this means, let's say you make it to your initial stage. This is when you, as a member, pay your low co-pays for your prescriptions, and the company pays the high remainder. So say it's a $100 prescription drug, and you just have a $5 copay, and the company pays $95. Okay? So then stage 2 is when you're paying the low amount, and the company's paying the mass remainder. Once the amount that you've paid, plus the amount that the company's paid, so basically 100% of the cost of the drug, once that's reached $3,310, you're done with stage 2, and you move on to stage 3, the coverage gap. This is when everything flips. This is when you pay 51%, correct, T? It changes every year, guys. I'm sorry, we stay on top of it. It's where you pay 51% of generics and 45%.
I think it's 40 this year.
Is it 40 now this
I
year?
think it's 40 this year.
If it's 45, you blame her on that one, not me. A brand name. So this is where everything flips. This is when now you're paying 40 to 51% of the cost of your prescription drugs. And the company is paying the remainder. Okay? Now, a lot of people think, well, I reached 3310 in this stage. That's only $1,540 left I have to pay, and I'm only paying about 50%. That's not much. Unfortunately, that's not the case. Let's say in stage 2, you paid $310 and the company paid $3,000. The only amount in stage 2 that transfers into stage 3 is the amount that came out of your pocket. So now you have about $4,500-ish to meet where you're paying 40 to 51% of the cost. Okay? I don't want to scare you. If you don't take many prescriptions, or there's a lot, you take majority generics, maybe a couple brand names, you probably will never ever see the coverage gap. But if you take some substantial prescriptions, a lot of brand names, insulins, heart medications, all my diabetic individuals and people who take heart medications, they all hit the coverage gap. Usually around, depending on how many insulins, usually around August, September. But then you'll hit your coverage gap, and a majority of people never get out of it, because the majority of people don't ever hit that amount to move on to stage 4. But let's say you meet that amount, you reach the $4,850, you now moved on to catastrophic. This is where you basically pay $2 to $6. Yeah, $3. Gotta undermine me.
I do.
In front of all my friends, Tracy. You pay about $2 to $6 for all your prescriptions, and then 5% for the significant prescription drugs. And that is good to the end of the calendar year. Starting January 1st, you start all over.
5% for what?
It's called Tier 5 specialty drugs. So it's the really, really, really intense drugs. But all your Tier 1, Tier 2, which are generics, Tier 3, Tier 4, which are brand names, those are all going to be in the catastrophic stage between $2 to $6, $3 to $8.
So $4,850 was the amount that you have to end up paying?
That's the amount that you have to meet where you're paying 40 to 51% of it and the company's paying the rest. So basically, thinking simply, just split that in half. That's kind of a safe way to think. I got to come up with another $2,400. We're going to actually go over a Medicare Advantage plan. Okay? So now, this is what's so important to know, is that, again, there's 7 different companies. We're not trying to push any specific company, but Medicare law states that if we're going to do this type of meeting, and we're going to make it actually educational for you, we have to file it with a company. So therefore, we have to specifically go through that one company. So we chose United Healthcare for this meeting because United Healthcare tends to have, it is a large company in the state of Utah, high membership, and we just think gives you a good idea of what a Medicare Advantage plan looks like, okay? So, but just because we're going through it does not mean we think it's the best one for you. It's very important that we go over your specific individual needs, all right? So if you guys have your books, let's go through a Medicare Advantage plan. We're going to go over what's called Plan 1. United Healthcare has two different plans. Plan 1 is $29. Plan 2 is 0 premium. I won't go through both, but the main difference between the two, not the only differences, but the main difference between Plan 1 and Plan 2. Plan 1 is $29 premium, therefore a majority of your copays are lower, and you do not have to get a referral from your primary to go to anyone else in the network. That's the main difference. Plan 2, which is a 0 premium, copays are a little bit higher on a majority of benefits, and you must get a referral from your primary before you can go see any other doctor. Okay? All right, so if you look on the left side on page 8, this is like a benefits at a glance. This is what majority of people utilize, so they go over this. So you see the plan's $29. Your doctor visits, if you go to your primary, it costs you nothing. Plus, on every Medicare Advantage plan, all your preventatives, your annuals, are all covered as well. Specialist is $40. You never have to go to your primary to get a referral. You can go to anyone in the network. Preventatives, again, you see are free. Inpatient, if you're hospitalized, like we went over, you're looking at $295 a day for days 1 through 5. If you're in the hospital for more than 5 days in a single stay, you're covered 100%. Skilled nursing, this is a lifetime, not a per visit. You have 100 days lifetime for skilled nursing. Days 1 through 20 are free. Days 21 through 51 are $160 per day. And then days 52 to 100 are covered free as well. Outpatient, so if you go get surgery where you're in that morning, you're out that afternoon, it's a flat $260. So that's a good example of that would be cataracts. So if you go and get a cataract surgery, you're looking at $260 all-inclusive outpatient for that cataract.
As a benefit.
As a benefit, correct. Any outpatient surgery, yes. Diabetic supplies, if your monitor supplies, your test strips are all covered. Home health is free. Diagnostics, whether it be radiological or tests, non-radiological MRIs, CAT scans, is 20% of the cost. Labs, so if you go and get blood work, it's $10 for the labs. X-rays, $11 per X-ray. Ambulance, doesn't matter if it's 1 mile or 100 miles, doesn't matter if it's by land or by air. It's a flat $250 copay. Emergency room, $75. If you are admitted into the hospital within 24 now, is it 24 or 48? Okay, 24 hours hospitalization?
Yes.
Okay, so if you go to the ER and they admit you into the hospital within 24 hours, they waive your ER copay and you automatically start going to the inpatient.
It says here worldwide, so if we are traveling and we are somewhere far away.
We're at time, okay? Yes, so on any Medicare Advantage plan, if you ever go outside of your service area, you're only covered for 2 things: emergency room or urgent care, okay? So you can now, if you go outside of the country, this is where it gets a little difficult, so I'll give you a brief little thing on it. This may be shocking, but the only country that cares about American Medicare is America. I know it's crazy. But every other country does not care about what they're going to ask you for your card, and they're not asking for your Medicare card. They're asking for the one that says Visa, MasterCard. So you pay whatever they tell you to pay. You come back. You submit your receipts with your agent. You do what's called a claim. The company will reimburse you everything except for the copays you would have paid had you been here. And there's a little asterisk up to the American Medicare allowable amounts. So if a company charges you more for a service that is allowed here in America, they're only going to pay you up to the American allowable, and you'll pay the excess. All right, did pretty well. That's pretty quick. All right. Urgent care is $30 to $40 for urgent care, and again, on this plan, it's max out of pocket. The additional benefits, your physicals, you get 12 $20 for an eye exam, 1 per year. They'll give you some stipends, as you can see, towards glasses and contacts. You get preventative only, so 2 cleanings, x-rays, and exams only on this plan. Hearing aids, I'll show you that hearing aid right down there. If you flip to the next page, page 9, you see the fitness benefits that we talked about. Silver sneakers. They also give you over-the-counter, $50 per quarter, so that's $200 a year in over-the-counter stipend towards things you may need over-the-counter. And there's a 24-hour nurse line. And then we're going to talk about the tier 1, tier 2, tier 3, tier 4. It's called a formulary. Our job is to put in your prescriptions, and we're able to tell you immediately where your prescriptions line up on that formulary. Are they tier 1, tier 2 generics? You can see the cost. Are they tier 3, tier 4 generics? You can see the cost. Or tier 5. And you can see that breakdown of cost right there. All right, and then we went over the coverage gap. The last couple things that this is, I promise, real quick. You're going to move to page 20. I have to show you this. Page 26. If you guys liked what I said, but you would like me to say it in a different language, these are the different languages we can send you the benefits to. And then, star rating is, there's a star rating. Remember we were talking about the reimbursement, how much a company gets? Thank you, sir. So, star rating. A majority of the amount that a company gets reimbursed if you go on a Medicare Advantage plan is based on star rating. And the majority of star rating is based on customer satisfaction. So I'm not going to go into all the star ratings, but United Healthcare is a 4.5 star for their 4-star for their health plan, and then 4.5 for their prescription. And it just went up 2017, and they haven't come out 2017. So that's the 2016 rates. Okay. So it's a very strong plan, but again, may not be the best for everyone, but it gives you a good idea of what all Medicare Advantage plans look like. All right. What would you guys? Yes.
You said nothing about assisted living. Is that because?
Assisted living is never covered by Medicare. It's all out of pocket.
So if you go into assisted living, you still pay your $134 a month?
Correct. Yes. As long as you're on Medicare, you'll pay that premium. Yes, ma'am. If you go into assisted living, do you still have to pay that premium? Yes.
And then you get coverage for the medical things, but you don't. You have to cover your own the cost of the.
Correct. If you go in assisted living, you'll have your coverage and copays and coinsurances for medical, but the actual assisted living is not covered by Medicare. It's 100% out of pocket.
Or long-term care policy.
Or long-term care as well. Anyone else? Yes.
How do companies like you receive your compensation?
Great question. The reason why we're licensed to everyone is how we compensate is what she asked. If you were to use us, whichever company and whichever product we agree is the best for your health and prescription needs, that company pays us to make sure you are happy throughout the duration on that company, whether that be 1 year, 2 years, 5 years, 10 years. If during open enrollment you decide we're discussing, we see your prescriptions have changed, or something has changed with the benefits and we think you're going to be better served on another company, we then come in, assist you in getting enrolled on that new company for the new year. That company now pays us to make sure you're happy and taken care of. Star ratings skyrocket for companies that have agents helping their members. So they're happy to pay us to make sure you're happy. Did that answer the question? Yeah. And it's important. If you use an agent, our costs are never embedded secretly somewhere. You're going to pay the exact same amount whether you do this on your own or you use an agent. It's never embedded anywhere. Okay? I think if you don't mind, you want to kind of end, and then Tracy and I are going to be in the back, as well as Mike and Curtis, and answer any kind of questions you guys may have, like personally, if that's okay. All right? All right. We appreciate y'all's time. Thank you so much.